presented at this year's ESMO is a combination study of SD-101 and Pembrolizumab, an anti-PD-1 antibody. SD-101 is a TLR9 or toll-like receptor 9 agonist, and it's different from prior agents that agonize this system in that it produces a profound type 1 interferon response. It's actually a different sequence of the CPG, of the nucleotide. And what we saw in the earlier studies with SD-101 as a single agent is clearly the ability to turn on the innate immune system and a type 1 interferon response. Now, for the first time, we're combining it with Pembrolizumab in patients with squamous cell carcinoma of the head and neck in two cohorts. One cohort are patients who've never been treated with an anti-PD-1 or anti-PD-L1 antibody, and the other cohort are patients who have been treated and whose tumors have unfortunately progressed. In that PD-1, PD-L1 naive population, what we're seeing are some very striking responses, about twice the rate that we'd expect to see with Pembrolizumab alone. Some of those responses very deep, but what's really interesting is that remembering that this is an intratumorally injected agent, so it has to be injected right into the tumor, we're seeing responses in non-injected sites. So clearly what this agent is doing is producing what we call an abscopal effect, or some sort of systemic immune response that is augmenting what we see with Pembrolizumab alone and resulting in about a 30% response rate of the combination in PD-1 naive patients. In those patients who have had anti-PD-1 antibody, we are seeing responses suggesting that this agent is somehow reversing that resistance, although the response rate is still in the single digits. So it's much lower, but the fact that we're seeing response rates suggests to me that mechanistically we're doing something positive for the patient, at least in some patients. And of course we need to understand who those patients are and what exactly is going on.